Well, in 2012, roughly 1 in 10 Americans came down with the flu. Here to let us know what works, what kind of works, and what doesn't when it comes to fighting the bug is Randy Vawdrey from Physicians Immediate Care. Well, thank you very much for stopping by this morning.
Thanks for having me this morning.
Well, I guess first off, what are the kind of the classic signs and symptoms of the flu? How do you know for sure it's the flu and not just the stomach flu, the food poisoning?
Okay, good question. So right now there's really kind of two flus that we talk about. One is stomach flu. We call it gastroenteritis, and it's where people get nauseated and they vomit or they have bad diarrhea. And that's different than the typical respiratory flu when you talk about flu season. It's a little early for flu season. We've tested a couple patients positive so far, but really right now there's just a lot of upper or GI stuff, stomach bugs.
So that kind of stomach bug. What I guess is the first thing that works when dealing with the actual flu? What's a known remedy, home remedy that people can use?
Most people just need to push fluids. And the thing that I wanted to make sure people understood today is that when are you in trouble, right? Because people will call and say, do I need to be seen? With the stomach flu, people oftentimes report nausea and vomiting and a little bit of diarrhea, but it's typically very short-lived.
Right.
Unless there's blood in the stool, for the most part, people do okay. It comes on with a vengeance, and then it disappears about as fast as it came on. But dehydration really is the risk. And so we just encourage people that home remedy would be push a lot of fluids, maybe not just straight water, but fluids that have electrolytes like broth,
so it's
Gatorade,
sports drinks,
Sports drinks, yeah.
Okay. As for what kind of works? What are some things that work kind of marginally when it comes to fighting the flu?
You know, when you're fighting the flu, oftentimes if you need medicine, it's medicine to settle your stomach. So a little nausea medicine can slow the nausea and vomiting down. It can also help slow down the diarrhea and the loose stools. In pediatric patients, a little Benadryl will often help to dry up the stomach so that the kids don't feel so nauseated and throw up. Kids are certainly at a little bit more risk of dehydration than adults are, but those are the medicines that seem to help minimize the symptoms so that you can pass the bug.
And then you hear about the old wives' tales of things people say works for them. What are some things that do not work that maybe have been pushed out there before?
That's a good question. I hear all kinds of stuff in the clinic, and I say that if it makes you feel better and it's over the counter, it's probably safe.
Okay.
I don't know that there's any real danger things, but the key is just hydration.
Just stay with the fluids. Lastly, is there any real way to prevent the flu?
Wash your hands. Yeah, if you're sick, don't go to work. Don't send your kids to school, right? During this time, we live in such a fast-paced society that everyone wants to keep going, and they come in and they say, oh, I just don't have any energy. Well, you should probably stay home if that was the case. Okay. Stay home from work so you don't pass the bug. Wash your hands. If you're coughing because you have respiratory flu, put a mask on, cover your mouth. I mean, just the simple things that Grandma and Mom used to tell you to do.
How about those little bottles you see? I see a lot of people carrying those around of hand sanitizer.
Oh, yeah,
are those worth it?
Okay. Yeah, great idea. I mean, we have sanitizer everywhere, and my wife is the sanitized queen, right? Someone gets sick, and you're Lysoling everything in your house, put sanitizer in your purse or in your car, and we do that every time the kids get in the car. We say, all right, everyone sanitize, and put a little bit of that alcohol-based sanitizer. I think it is helpful.
All right, cool. Thank you very much for stopping by this morning.